Welcome. I'm Leanna Joyner with the Appalachian Trail Conservancy, and this is a training on volunteers working on the Appalachian Trail doing field work during the time of COVID-19. This training will begin by addressing all AT volunteers and any person who works with volunteers. The second segment of this training is focused on information that volunteer leaders and staff should keep top of mind when leading activities in Phase 2 or Phase 3, primarily. There may be isolated instances where more than one approved worker attends to an assigned task in Phase 1, and if that occurs, then the same information applies. This training specifically addresses trail and field work activities related to AT stewardship. Complete details for activities highlighted in this training are available in the accompanying guidance documentation and job hazard analysis, otherwise known as a JHA. These tools, both the guidance document, this training, and your JHAs, accompany your volunteer service agreement as you move forward with work on the Appalachian Trail during this time. Because this training is general and because volunteers and staff are only addressing privy maintenance by mutual agreement by management partners in this period of time, privy maintenance is not covered in this training. Complete details for the operation of safe privy maintenance are found in the guidance documentation, the backcountry sanitation manual, and applicable JHAs for privy maintenance and COVID-19. Let's talk about deciding when to volunteer. Because a framework does exist to determine when an organization decides to return to work and thereby when volunteers may go back to work on the trail. This decision to resume field work will exist for most phases of work activity when the following conditions are met. First off, state and local authorities have lifted stay-at-home orders, and land managers have lifted any closures that would prevent activities on the trail. An important thing to remember here is that tracking local area statistics related to decreasing cases of COVID-19 will be a consideration to the degree and the amount of work that is possible as we begin to discuss phases that we will do on the next slide. Furthermore, I want to point out that there are decision tools for organizational leaders related to making those decisions based on 14-day trends. Those resources are contained in the adaptive recovery guidelines and standard operating procedures that are being shared as a supplement to this training. The tools specifically are an AT county level COVID-19 map and a 14-day county level data tool for further distanced counties from the trail. Additionally, there is a risk calculator app in the adaptive recovery resources and a link to available trail safe training found on ATC's website. This full suite of materials is intended to enable the kind of local decision making for AT mobilization of volunteers. The next factor in deciding when to volunteer is related to participants being free of COVID-19 symptoms for 14 days. This is done through a self-screening process before any work activity, and we'll talk more about this later in the training. Finally, appropriate personal protective equipment, known as PPE, is available for a given planned activity or task. There are some really key things to remember, and now's a great time to point them out. Volunteering is not an essential activity. Volunteer activities are optional. Personal discretion goes into deciding when and if volunteering is right for you. Deciding not to work during this period of time will not affect a volunteer's current status. And overall, this is a great time to employ cautious decision making. We want you to know that we support you making the decision that is best for your well-being. The best practices for implementing safe operations are shared in this training so that when the time is right to resume activities, these practices are put into play as a minimum set of safety standards for AT volunteers. There are 3 phases used by AT managers in defining the degree of field activity. In all instances below, local is both the origination location for workers and the area where the work is to occur. In phase 1, if local county level COVID-19 cases are not decreasing, then field work is only performed by requests made by land managers only. During phase 1, work activities are solely limited to health, life, and safety. During phase 2, if local county level COVID-19 cases are decreasing for 14 days, then groups of no more than 4 may perform field work. Those fieldwork activities will focus on trail planning and scouting, health, life, and safety concerns, maintaining the trail for access, and identifying and documenting resource damage. In phase 3, if local county level cases continue to decrease after an additional 14-day period, then groups of no more than 10 people may perform fieldwork. During phase 3, activities are those that are included in phase 2 and additionally include in-person trainings and repairing resource damage that may include work beyond essential maintenance activities. Activities within any of these phases should ensure that the scope of work retains the 6-foot physical distance between workers and that individuals have and wear face coverings as described by the CDC. As a reminder, the Adaptive Recovery Guideline resources include links to tools to determine 14-day trends.
All AT volunteers are asked to be aware of guidelines and to understand their personal risk. According to the Centers for Disease Control and Prevention, those at high risk for severe illness from COVID-19 are people 65 years and older, people of all ages with underlying medical conditions, things like heart conditions, lung disease, moderate to severe asthma, diabetes, kidney or liver disease, or those who are immunocompromised. Please visit the CDC website on COVID-19 where information is updated as new information is available. If, after understanding risk, individuals are willing to undertake this optional activity of volunteering on the AT, they are asked to review safety resources and procedures, this training, and acknowledge the receipt and compliance with these guidelines, all found at appalachiantrail.org/volunteer/COVID safety. Once you've signed up to volunteer, you'll want to be sure you do a self-screen of your health before the workday, pack for self-sufficiency, and be familiar with and able to practice CDC hygiene protocols like proper hand washing and hand sanitizing techniques, proper ways to put on and take off personal protective equipment, and have available to you a face mask or covering that meets CDC recommended guidelines, and maybe a backup. Find links to these resources in the Adaptive Recovery Guidelines SOP resource. Because it bears emphasis, before showing up for any activity, volunteers need to do a personal health check. A reference for symptoms to check for is on the COVID-19 safety page. If you have symptoms or have had exposure to anyone with these symptoms or a confirmed case within 14 days prior to a work trip, please stay home. Basically, the expectation is that you be well and have been well recently when you show up to volunteer. As you head out to do good work, please pack to be self-sufficient by carrying enough clothing, layers, water, food, your own washable gloves, face mask, and hand sanitizer. Again, you may want to consider bringing backups as well. Take stock of travel conditions to get to the work site. Travel alone or only with others from your household. Generally minimize stops to reduce opportunities for virus transmission and consult the additional resources on this subject in the guidance resource document. Not all locations on the trail are socially isolated due to the scenic nature of the site, the proximity to population centers, or ease of access. Volunteers planning for work at higher visitation sites should adapt to changing conditions. It may be necessary to end planned work if an area becomes too crowded to maintain sufficient social distancing. Be flexible. Volunteers are allowed and empowered to speak up if they see something unsafe. Activity leaders have protocols to follow if a volunteer gets sick while on a work trip. Bring transparency and disclosure to your volunteerism so that if you feel sick during the activity, it can be acted upon. Be honest and upfront about how you feel. After the activity, hopefully you're basking in the glow of time spent outside and great work accomplished. However, if you become ill following a workday, notify your trip leader as soon as possible, and they will preserve your privacy while communicating with others who would have been in contact with you. This form of contact tracing, followed by appropriate response by those informed, is a known way to reduce virus transmission.
Hello everyone, this is Hawk Matheny. I serve as the Senior Regional Director with the Appalachian Trail Conservancy in the Northeast. And I'm going to speak with you here a little bit about what every activity leader should know in order to conduct a volunteer activity safely during the COVID pandemic. So in addition to regular work trip planning, all the steps that you've normally taken, prepare for your activity during this time by managing registration. All volunteers need to read, acknowledge, and adhere to the following COVID JHA and this training. They can do that by visiting appalachiantrail.org/volunteer/COVID safety. This important step ensures that they are covered under their volunteer service agreement for their work. Disinfecting all group gear. Guidelines and products for disinfecting are found in the COVID JHA. Disinfect before issuing to participants and disinfect again before storing after use by participants. Participation limit for phase 2 is up to 4 people, and for phase 3 is up to 10, including the leader. By formalizing a registration process rather than allowing walk-up participation by standing volunteers, organizing groups can prevent convening more than the set limit by aligning necessary trip leader with available volunteers. ATC can help set up online registrations for your work trip. Inquire about this by emailing volunteer@appalachiantrail.org, and Sarah Leanna will help you out with that. While all volunteers are asked to be self-sufficient, leaders should bring extra personal protection equipment like hand sanitizer, face masks, and impervious gloves for the workday. Trip leaders should give consideration to the number of people traveling separately to the volunteer-based activity on the given phase of operation. Be familiar with available parking space and the likelihood of availability for volunteers and visitors at a trailhead. During the activity, be sure to emphasize COVID-19 considerations and JHA protocols into the tailgate safety session and empower volunteers to all take responsibility for safety. Maintain physical distance of 6 feet or more from other volunteers and visitors. If a volunteer activity requires that volunteers be closer than 6 feet, then that activity should not be performed. Remind participants not to share tools throughout the day. Establish hand wash routines and plan for health checks throughout the day so that anyone who may develop symptoms can receive care and evacuation if needed. Thank you for considering these important guidelines.
Hi, this is Morgan Somerville, the Appalachian Trail Conservancy Southern Regional Director. Of course, the point of this training is to keep everybody safe. Trail maintainers are one of the ATC's greatest assets, and so it's important that you all stay safe. So with regard to this slide, no camping for work trips. It's difficult to social distance during those times. You should be prepared in advance for a volunteer becoming sick on an activity. We have best management practices listed in our adaptive recovery resource guidelines. For overnight site management, shelters and privies will not be cleaned and maintained by volunteers until further notice. There may be some exceptions to that, but the reason for that is because the two things. One is that shelters and privies can become contaminated, and you can clean them, and they could become recontaminated almost immediately. So it could be a waste of your time. Secondly, the contamination in a shelter is quite probable. It's very difficult to social distance in a shelter, so it's unsafe for users. And there is some research that shows that the virus might persist on wood, plastic, or metal for as much as a day or more. And so it is not a good idea for you to clean those surfaces or picnic tables or the food storage devices, etc. In terms of the privies, all privy maintenance should strictly follow current health and safety guidelines to avoid exposure to COVID-19 and other transmittable diseases. Again, there is some research that shows that the virus may persist in fecal matter, and so it is extremely important, well, first of all, that you don't clean the privies until further notice, but secondly, if an exception is made, that you wear all the appropriate PPE and do an excellent job of keeping yourself safe from contamination, because there is potential there.
Thank you so much for your attention to this training. We welcome your feedback and any questions that you have at volunteer@appalachiantrail.org. And thank you for all that you do to support the Appalachian Trail.